Prime Minister of St. Martin has made it official. No carnival or Heineken Regatta for 2021. Chief Customer Officer at SZV talks medical insurance and who qualifies. And Minister of Public Health gives update on the launching of the coronavirus vaccination planning and implementation process. Those are the headlines for Wednesday, January 27th, 2021. Good evening, viewers. This is SXM Daily News, and I'm Valerie Van Putten. Thank you so much for joining me this evening. And as usual, we have a full newscast for you, so let's get started. In our first story, Minister of Public Health, the Honorable Richard Panafleck, gave an update of the meeting he had with the Red Cross on the launching of the coronavirus vaccination planning and implementation process at this morning's Council of Ministers weekly press briefing. But first, the minister gave the latest statistics about the number of active COVID cases that we currently have on the island.
There are currently 129 cases that are actively being monitored. These are the figures that we received yesterday. That's what I'm reporting right now. As I said, I will come back with the figures that we have received in the meanwhile. On Saturday, 23rd of January, I was accompanied by the head of the Collective Prevention Services, Mrs. Lisa de Weaver, to meeting with the Red Cross officials, whereby we discussed the support from the Red Cross with the launching of the COVID-19 vaccination planning and implementation process. And we discussed the support from VSR to the Red Cross food program. The Red Cross was very supportive with the community outreach program during the first wave, and I am looking forward to their support once again. CPS continues to monitor the COVID-19 situation on the island, especially seeing that the Caribbean region is now dealing with also the UK variant. In addition, as of this morning, as I said, January CPS registered 1,805 confirmed cases. The reason for that is that after the cutoff time, when we get the reporting, the daily reporting, more information came that was after the reporting time that we will release to the media. But trying to be giving you the numbers that we have right now, I decided to do that as the information has reached to me. This don't mean that automatically the active positives is just that you add up 38, because there are recoveries also, but those recoveries will be subtracted later during the day. CPS has already started to send samples to REVM for genotyping on the weekly basis, and once this information is received, this will be communicated to the public.
And in other news, the news that the SCDF was in the process of organizing their annual festival has been met with resistance by many, including the healthcare and frontline workers at the St. Martin Medical Center. In this edition of SXM Daily News this evening, you will now hear from other members of the WICUA, namely retired nurse Margriet Priest, Vice President of the WICUA, Jacqueline Burkel, and Treasurer Charlene Arundel. Speaking at their press conference at the St. Martin Medical Center yesterday, the members are of the opinion that government knows what they went through with the first set of COVID, and they don't want to go there. Meanwhile, the Vice President said that government is fully aware of the strain the first wave of COVID put on the healthcare system and the entire community of St. Martin. The treasurer of the WICUA told reporters that contrary to what the president of the SCDF said about life becoming cheap, life has become very precious.
This time we tell government that they know what we went through with the first set of COVID, when COVID started here in St. Martin. We don't want to go there. At this moment we are safe, some kind of how safe, because we have things under control. But if we do bring this carnival, then we start back with all the other strains that it has, a heavy load on our workers. And as a government, I find we can dialogue. We are all part of this community and everybody has a say.
And as my colleagues have all stated, I think that government should strongly reconsider approving Carnival. As Nurse Priest just said, the government is fully aware of the strain the first wave of COVID put on the healthcare system and on the entire community of St. Martin. Now with all the new strains coming out and approving Carnival, even if it's, as they say, not 12,000 but 4,000 people allowed in the village, that's still too much. Our hospital cannot accommodate 4,000 people.
And I was one of those in the middle of COVID in the first wave. And I would like to comment really on what the president of the CDF, that's from the Carnival Committee, said, that life has become so cheap and life has become so precious, especially for those that cannot see their loved ones when they are on their deathbed dying and you are not allowed to come in and see them. So I would like to say to him, he should rethink what he's saying when he said life has become so cheap without Carnival. No, life has become very precious.
Meanwhile, with the cancellation of the planning and execution of Carnival 2021 and the St. Martin Heineken Regatta, the Prime Minister of St. Martin, the Honorable Sylvia Jacobs, has made it official that there will be no Carnival 2021 or a Heineken Regatta. The Prime Minister said the cancellation of Carnival and the regatta was in the best interest of the health of the citizens of St. Martin. But before coming to that decision, she consulted with the relevant stakeholders, and based on CPS's reports, the active average cases remain steadily high.
As I mentioned previously, yesterday, January 26, the Council of Ministers decided to cancel the planning and execution of both Carnival and Heineken Regatta for 2021 in the interest of the general health of the citizens of St. Martin. In order to arrive at this decision, we consulted with various relevant stakeholders, including healthcare professionals and law enforcement, on the presented reduced activities planned for the Carnival 2021 as well as Heineken Regatta, and considering the impact that such events would have on the population. As such, the St. Martin Carnival Development Foundation, SCDF, and Heineken Regatta organizers have been informed of this decision. A press release was also published, but I would like to remind the people of St. Martin, especially as has been reiterated by our Minister of Health, that based on CPS's latest report of January 25th, the active average cases remain steadily high, not only as a result of the holiday festivities, but also due to apparent, so not proven, but apparent complacency with the public health measures among the population. And if this continues, it is expected that it will increase. The Council of Ministers therefore urges the general public to take heed of the mandatory guidelines implemented for your own health and safety. I myself went back to what is published on our Facebook page, on our website, and have reread some of these guidelines. And I suggest that all those business owners with those guidelines in place to be able to open up after the lockdown should ensure to go back and refresh yourselves. I have visited a couple of restaurants and noticed that some of the serving staff are not consistently wearing masks or are not covering their noses. This is not the correct way to use the mask, and government has also endeavored to give good updates on what is correct mask usage.
And still to come, local cardiologist explains the importance of lifestyle management. I'll have the details to that story and much more when SXM Daily News returns.
Hi, I'm Switch.
And I'm Save.
And together we're here
to tell you about WIB, Switch, and Save mortgage offer.
Now at WIB, you can save and benefit from great specials when you decide
to bring your mortgage to WIB.
When you switch, WIB will offer you
payment of penalty fees up to 3 months interest,
payment of notary fees,
waive of bank closing fees,
and also the lowest interest rate.
Plus, you'll have the chance to win back 1 year of interest payment.
Visit any of WIB's mortgage specialists and benefit from WIB's Switch and
Hey, that's my part. And Save mortgage offer.
WIB, your partner in progress.
Welcome back, viewers. You're watching SXM Daily News, and I'm Valerie Van Putten. In more COVID-related news, the COVID-19 vaccine rollout and whether or not people will take it is being met with some resistance and varying opinions. Jenny Steele, a reporter with Caribbean Network, files this report.
It's important that as many people as possible take part in this vaccination program. If everybody takes his or her responsibility, we can help each other. The more people that are vaccinated, the less chance that there will be a catastrophe situation.
The coronavirus vaccine is due to arrive in St. Martin in mid-February. It's caused some division amongst the local community, with people deciding whether or not they want to take it. Some people feel confident in the vaccine, others are not so sure, suggesting that it was developed too quickly for them to be confident in it.
Because I do not believe in that.
Yes, I would take it.
I try to stay away from certain movements.
Yes, I will take the vaccine, yes. I think it's a good thing for St. Martin.
If I can not take it, I will not.
Seeing my age, definitely I will be one that will be taking the vaccine.
I don't know. I think it's too short. The delay is too short.
I believe in science.
I will take it.
It's too young. We don't know at the future what this vaccine will cause on the body.
The way this vaccine works as a messenger, it makes it changes our DNA structure. It's actually a kind of genetic manipulation what we are doing here.
I think it's kind of a new technical breakthrough. It's a huge step forward in the production of vaccines. I'm really surprised and happy. The vaccine has proven very effective, a low amount of side effects. So it's more effective than the regular flu vaccines.
It is a biochemical liquid that they're going to put into you because it doesn't conform to what the vaccine actually, the definition of the vaccine is.
At this point, with the several million of doses that have been given, it looks safe.
Let's look here on St. Martin. Do we need a vaccine here? I don't see the numbers in the ICU that we are overwhelmed. I don't see people overwhelmingly dying from corona. The deaths we had here are mostly people like, okay, this is a bit a standard saying, now they were old, they were already having underlying sicknesses and they died with corona. But this is how it is. And the numbers are not bigger than when we had influenza.
If you're part of a risk group, so you have a comorbidity, you're older, I would advise to take the vaccine. This vaccine is more effective than a flu vaccine. And for a flu vaccine, I would advise the same thing.
Do we need a vaccine because it's going out of hand and we have to, our species have to survive? No. We can do with our lifestyle so much more than with tablets, pills, and vaccinations.
And as we continue now in other news, the St. Martin Heart and Stroke Foundation, which is organizing their second annual Wear Red Day in the form of a mini symposium on Friday, February the 5th, 2021. The topic of lifestyle management was discussed with a member of the foundation, local cardiologist Dr. Emiko Bird-Lake.
When we look at that, we know that people need to do a lot more for their own health, and meaning lifestyle management, because when you're first diagnosed with high blood pressure or diabetes or high cholesterol, the first thing that we talk about is lifestyle management. How do you eat less salt? Change the fatty foods that you're eating. Do more exercise, even if it's walking and half an hour a day. Change your lifestyle. That's what we're trying to at first advise. And if we see that there is not enough reduction or better regulation of your blood pressure or your high cholesterol or your diabetes, then we go to medication. So that is, in any case, our advice is how we start. And we have our guidelines of what we call high blood pressure, high cholesterol, and high diabetes. And what I've always taught from the moment that I got here is know your numbers. Know what your blood pressure is. What is my upper level? What is my lower level? Know your heart rate. How high is my heart rate? Know your glucose level and your HbA1c, which is a measurement that we do in the blood to check to see how high your glucose levels have been in the past 3 months. So it tells you a little bit more. When you do a fasting morning glucose, for example, it's a spur of the moment. You could have eaten something that was with too much glucose the night before, where your fasting glucose could be high. But your HbA1c tells you what your average glucose levels have been in the past 3 months, which gives us more information. Then we're talking about, so all of these are risk factors: high blood pressure, diabetes, high cholesterol, obesity, smoking, sometimes too much alcohol, drug abuse. Those are all, and let us not forget the genetic factors, and ethnicity. We have a big Indian community, a large Indian community, and we know that in India, people have at very young age, and I mean in the late 20s, even early 20s, early 30s, 40s, are already getting heart attacks at a young age. So ethnicity and your genetics are important. And those are factors that you cannot do anything about. You're born from a mother and father, and they have either a genetic problem or you yourself develop a genetic problem. And therefore you can get clogging of the arteries, and that's how you get a heart attack, when one of the arteries are clogged and blocked and the heart muscle is not getting enough oxygen and enough blood flow to it, and you get chest pain, and it can lead to a heart attack. Now, if you've had a heart attack and a part of the heart is damaged, that means that the pump function is reduced. That can lead to heart failure, and that's congestive heart failure. So our pump function is never 100%. So when I tell them that their pump function is 53% for women or 55% for men, it seems like it's doing for half of it. No, but that's just how the pump function is, and that is normal. But anything below that is abnormal, and then you range it from mildly abnormal, moderately abnormal, or severely dysfunctional. And depending on how dysfunctional it is, also can lead to congestive heart failure. Now, what is congestive heart failure? Congestive heart failure means that your heart is unable to pump all the blood to the body, and it sometimes can go back into the lungs, where you get short of breath, and can flow back into and below to your legs, and where you get swelling of your legs.
And as we continue with our series this evening with our health insurance provider, SZV, this evening we will continue with some of the frequently asked questions about services provided by SZV. We will continue our conversation now with Chief Customer Officer at SZV, Mrs. Parveen Burcha, about medical insurance and who qualifies.
Well, there are a few tips that I can share on that. And one of the most important is, and that's where it usually starts, is that if you are employed. So if you have an active employment, and that is traditionally the starting point for your ZV insurance. So if you are employed at this moment and you're listening to the program and you think, wow, nobody ever told me about medical health insurance, that is the time to ring the bell and to contact ZV. Because the medical insurance for ZV insured is tied to your employment.
Okay, suppose you have an A-Act.
Yeah.
You know, you're still entitled to insurance?
So for the sole proprietors, you are not entitled to the insurance. For that, we refer to the private insurance. However, the employees that you have employed in your sole proprietorship, they do have rights to the insurance. You as the owner the owner is excluded, but the workers are included.
Oh, okay.
Yes.
And what about those that are still working after the age of 62, I think it is?
Yeah, that's a great question. Thank you for the question. Once you are employed over the age of 62, you still have rights to medical insurance under the ZV. Once you stop working over the age of 62, that is a moment where you really have to check your rights and regulations, because once you stop working, you are no longer insured for medical insurance. So that is a moment where you have to find another alternative way, either in the private sector or, depending on your personal situation, it can also be via the government medical aid program or via ZV's senior program.
Okay. Yeah. And what if you are a senior, 62 plus, and you want to start your own business?
Yeah, that's possible. Yeah.
That's possible also.
That's possible.
But SLP will not cover?
It depends on your the way your new business is set up. So if it's a sole proprietorship, you are the owner, you are not insured. But if you are establishing an NV, for example, and you are an employee on the pay list, you will have rights to medical insurance as an employee. Because once you're employed, we no longer look at the age.
Now, turning to our weather forecast for January the 27th, 2021. The Atlantic high pressure ridge is a dominant feature across the region. However, patches of low-level clouds associated with a frontal boundary will be transported across the region and account for occasional passing showers. Moderate to rough seas peaking up to 8 feet are expected during this forecast period and due to long-period northerly swells. Small craft operators and sea bathers should continue to exercise caution. So the outlook through Friday midday, partly cloudy to cloudy with isolated showers. Now let's turn to your 3-day forecast. And still to come, Minister of Finance gives updates on the cuts in order to qualify for COVID relief. I'll have the details to that story when SXM Daily News returns.
The innovative Banco Matico contactless smart card. Your Banco Matico smart card is now equipped with a contactless feature for payments, so get ready to tap and go. Contactless payments are fast, easy, secure, and accepted worldwide at all Maestro-enabled contactless terminals. Tap for transactions equivalent to or less than 100 NAF, or the US dollar equivalent. You will receive notifications via email anytime you tap. Tap, tap, and pay fast. Fast with WIB. For more information, visit our website at wib-bank.net. Tap and go with your partner in progress.
And you're watching SXM Daily News, viewers. And as we continue now with other news, NVGEBE has announced the launch of its yearly Senior Citizen Temporary Relief of 62 Plus program, which is intended to assist seniors with their monthly utility bills. Registration will commence on February the 1st, 2021. This program, which started in 2014, is geared towards certain eligible senior citizens. Its aim is to reduce the electricity costs for those individuals that qualify for this program. A lot of people are struggling because of the COVID-19 pandemic, said Dr. Shireen Daniel, interim manager of NVGEBE, and our seniors are an especially vulnerable group. We are pleased to at least be able to provide some financial relief to them. NVGEBE stated that senior citizens eligible for this program must apply and meet certain criteria in order to qualify. NVGEBE added that even the seniors who were previously a part of the program must reapply and meet the criteria. The relief granted will be in the form of a monthly fixed amount to be deducted from the electricity invoice. Applications have been made available as of Tuesday, January 26, 2021, and will only be available for 3 weeks. Deadline for registering is set for February 19, 2021. Applications received after this date will not be accepted. The program will run for a year, after which reapplication and/or reassessment will be necessary. Applicants must be 62 years of age or older at the time of applying. They have to be legally residing on the Dutch side of the island and must be a GEBE client with contract in his or her name. The registration form for the Senior Citizen Relief Program can be picked up at the receptionist desk in Phillipsburg, at the main office, or at the Simpson Bay branch office. After the form has been completed, together with the necessary original documents, said documentation can be submitted at the customer care located at the main office building in Phillipsburg and branch office in Simpson Bay. Please bear in mind that in order to qualify for the relief program, all documents must be submitted and the client must be in good standing with NVGEBE. Management of NVGEBE reserves the right to accept or decline any relief request at their discretion. This senior relief program will be transparent and everyone will be treated in a fair manner once they are able to prove compliance with the above-mentioned criteria. And as we end this edition of SXM Daily News for this evening, Minister of Finance, the Honorable Artwell Irion, gave an update this morning at the Council of Ministers weekly press briefing on the 25% cut in employment packages, the 12.5% cut of civil servants, as well as an update on the road tax. The minister said that the deadline for paying your road tax is now February 28, 2021.
This week, I joined the Prime Minister in Parliament meetings to discuss the laws that were presented in the negotiations for COVID-19 relief from the Netherlands. These include a Jacob's norm that entails that employees in the public and semi-public sector aren't to earn more than 130% of the Prime Minister's salary plus benefits. The 25% personnel cuts in employment packages, which applies primarily to ministers and parliamentarians. And lastly, the 12.5% cut, which applies to civil servants and was applied to vacation days instead of where we tried our best not to cut into salaries, use items such as vacation days and benefits instead of salaries. Lastly, the last update is in regards to road tax. The deadline to pay your 2021 road tax is February 28. Seeing as the lines have gotten a little longer, I encourage you to all use the online payment system. You are able to pay for multiple plates simultaneously online, meaning you can do this per household. You can find more information like the directions on how to pay your road tax and the account numbers pinned on my Facebook page, the government's page, and the website. Traditional methods such as the drop box located at the front of the government building can also be used, and cash payments are still available for those without online banking available to them.
And with that, viewers, it brings us to the end of this edition of SXM Daily News. I am Valerie Van Putten, thanking you so much for joining me this evening. And just a reminder that this and other programs are available online. Simply log on to stmartinmediacenter.com for viewing. And on behalf of the SXM Daily News team, we thank you so much for watching and plan on meeting you right back here again tomorrow.